Hello and welcome once again to our educational series. And so we are here another week with Dr. Pediatrician, Dr. Ana Olivero. And last week we had our topic in Spanish. This week we're going to do it in English about the importance of vaccines and our children, because it is a topic that's really important and something that Dr. Olivero brought to my attention, and that I agree and feel that it's something that parents need to talk about, although a lot of times in the United States, as we know, it can be a controversial topic. So welcome once again, Dr. Olivero.
Hello, how are you? Good night to everyone. Good night to you. Thank you. It's always a pleasure to be here with you in this program and in this wonderful conversation.
Thank you. I feel the same exact way. And so before we completely start, I want everyone to know that if you have any questions throughout the time that we're here together, please feel free to type them in, and Dr. Olivero will answer them as they come in. So it's wonderful. So how are things there in the Bronx this week?
We are really having a very nice weather in the city, in the Bronx. We are in phase 2 after the pandemics, COVID-19. Some of the business are being open, like on 25% capacity. Some of the businesses are open. They're gonna open the beach in New York City, I think is July 1st, partially open, and we are progressing really nicely in the measures after the COVID-19 pandemics.
That's wonderful. Now, since everything has been kind of opening up slowly, have you seen any spikes yet, or everything is still kind of the same?
I just listening to the news. I was listening to the news that some states like North Carolina and I believe South Carolina, Florida, they're having spikes and higher incidence of COVID-19. And cities are starting to take measures of quarantine for the travelers from these high number of cases states into New York City. And I think the mayor and the Governor Cuomo have mandated that we're going to put these patients on quarantine as early as tonight from midnight on. It was just in the news now.
So what does that mean? They're gonna put the states on quarantine?
Like if the travelers from other states, let's say they come into New York City from the airport, they have a temperature check at the airport, and if they're traveling from Florida, as an example, as a state with a higher number of cases now, they're going to be quarantined. I believe it's 14 days of observation. That's what was in the news this evening.
Interesting. Very, very interesting. Well, not to get off topic, because I have a million questions about that. However, our topic for this evening is vaccines and for children. And so one of the important things that we need to talk about is that, and one of the things that you had mentioned last week, is that with COVID-19 and ability of a lot of children or parents to go into medical centers, that a lot of children aren't at this moment getting their routine vaccines that they normally would get at this age. And so what is the situation, and why is this so important that these happen?
Certainly, the COVID-19 pandemic has put a disruption in the routine vaccine schedule for children, meaning that because we've been in quarantine, we've been in the lockdown, the measures that we have been taking, many centers for routine procedures have been closed or partially operating. There are a number of kids that have lag behind in their immunization schedule. And there are a number of other infants that are born inside the pandemic, and they have not had yet the chance to get vaccinated against the routine childhood diseases. So there is certainly a gap to catch up now in pediatrics, in children.
And so what should parents do then if, for example, if they have a newborn or if they have children that should have had vaccines but didn't? Should they be making appointments? Should they be going to clinics? Should they be going to their doctor? What is the proper measure to take?
I think the recommendation is for the parents to reach out to the centers, to the pediatricians, to the medical providers, to catch up, to close the gap into the delay immunization schedule as soon as possible. Because the importance of that, Christy, is that you don't want all these other preventable diseases that could be catastrophic in kids to present now, as I said, an epidemic inside the pandemic. We are trying hard to prevent this from happening.
Right, absolutely. Now, how do I phrase this? Why are these vaccines so important? And why are there so many parents, because there are quite a few parents that are against vaccinating their children? Why are they important, and why are so many saying, no, I'm not going to vaccinate my child?
Yes. Why are vaccines so important? They have vaccinations have certainly lead one of the greatest advances in medicine. The fact that we can now prevent catastrophic childhood diseases like poliomyelitis, like meningitis, like diphtheria and tetanus, is one of the most remarkable advances in medicine in the last century, I would say. We have seen many of these diseases mostly disappear. There are physicians from the younger generation that had never had the chance to see these diseases that were so common and killed so many children in the past just because of vaccines. An example, measles. Measles in kids could be a benign or transient, could be, but it has a very great potential to be catastrophic when it gets complicated. And many of the young generation of physicians, they had never seen it. We have seen so few focus of measles in the city of New York in some communities because a refusal of vaccination. And on the other side of that equation is the concern of the parents, the fear of vaccines, the myth, the information that is there about what are the consequences of vaccines. And this is what we have now on the table.
Because I think that's really important, because a lot of parents who don't want to vaccinate their children, one of the things that I've always heard that we talked about last week was that really what you're doing is injecting a small portion of the virus into the child, and there is the possibility, like a 1% possibility, that they could contract the disease from the vaccine. Now, what you had told me before is that now vaccines are more advanced, and that's not a possibility. Is that correct?
Yes, the history of vaccines has evolved quite a bit as we move on. There are certainly side effects from the vaccines. There are allergies to the vaccines, and those are the minimal cases. And the question if a vaccine is going to produce the disease is also a concern on the parents. Like, the basic concept of a vaccine is to inject a portion of a fraction of the components of that virus, of that agent into the recipient, into the child, to prompt the immune system of that child to produce a response, an immune response, an antibody response that is going to be there protecting the child if the child ever encounters the disease from another source that is not the vaccine, as an example, from another kid that is infected with the disease. That's a very basic concept. Uh, a vaccine, for example, the one case that I talk to my patients all the times is a vaccine like the influenza vaccine. Many times the particles are not dead, they're not completely inactive. There could be some activity, let's say it that way in a simple term for the vaccines. And the parents said, oh, but I always, or they could get the cold, they could get sick. And that may be an effect of this live attenuated vaccine, meaning that the particle is active. But as I said to the parents, okay, you're going to get a fraction of that virus for the child to respond with an immune defense against influenza. That could be a very catastrophic disease in some kids and older people as well. But you're not going to get influenza that is going to get you in the hospital on a ventilator for 2 weeks or very sick with a pneumonia. You may get some symptoms like a little runny nose, a low-grade fever, and they are all easily manageable at home.
So they might get a little cold as opposed to getting the full out flu. So, and that's.
Or a low-grade fever. There are side effects of the vaccines. It could be tenderness and pain on the injection site, low-grade fever, some redness, mild symptoms. But if you put into the balance these mild symptoms that are associated with the vaccines versus getting the disease, I think the gap is tremendous. It is a tremendous gap in this, I don't know if I made my point clear, but that's the
No, absolutely. So in other words, there really is no risk. If a child gets a polio vaccine, they're not going to get polio. If a child is going to get a measles vaccine, they're not going to get the measles. If a child is going to get the mumps vaccine, they're not going to contract the mumps. They're like and so that myth can be
the vaccines safe and they are highly effective protecting preventable childhood diseases.
Okay, great. So now let's go to the other myth that we had talked about last week also, which I never really thought about. But the myth of how a lot of people do not vaccinate their children because they think that their child that vaccines cause autism. What is it what do you have to say about that?
I encounter this concern quite often on my medical practice. Many parents come and they say, listen, I have a cousin and I know a friend and the child is autistic. I don't want this to happen. It's a valid concern from the parents. We all want to do the best for our kids.
Of course.
We want to protect the kids from these diseases that could be catastrophic, devastating. They could forever tint the future of a child. And the parents want to protect their kids. So this is very normal. We are in this common ground. However, when we look inside the kids that have developed autism, the scientific evidence has demonstrated clearly that the vaccines are not the agent that causes autism. That the measles vaccine that is being implicated, the MMR, measles, mumps, and rubella vaccine, is not the agent that causes autism. Many parents see that as an association because there has been, information and misinformation and myth, and there was a scientific debate also that was demonstrated that had no funds, that had no evidence whatsoever. And there is always the concern. And many times when a child develops autism, it's in the same age range where the child is acquiring the routine immunization schedule. But reviewing the literature and looking at the scientific evidence, vaccines, specifically the MMR, is not the agent that causes autism.
So then a question might be then, what is an agent that what does cause autism? Is that known?
We really have had this question for years. I know as a pediatrician that the number of autism cases is increasing. I've seen quite a bit of kids with autism. It's undeniable that kids present with autism and all the mild spectrum, the severe, the moderate spectrum autism. And we asked this question. What the evidence has shown so far that autism is a multifactorial disease. What does that mean? It's not one single factor that had been implicated in causing that disease. Like in other type of diseases, it's very simple. You get an infection on your ears, it's one kind of bacteria most likely, and you give an antibiotic, done. The case is resolved. But in diseases like autism, there are many factors that influence the disease. And as far as I reviewed the literature recently, there are single gene mutations, meaning changes in how the genes are entangled themselves into the DNA of autistic kids that are different from the others. Let me put in these words. If you look at a cell in the brain cell of a child that doesn't have autism, you look at it grossly in a child that does have autism, they look the same. You said, but there is no alterations in the brain tissue, there is not a lot of changes. But when they look at the genetic component and how these genes join to each other, there are single gene mutations or alterations in the kids with autism that we believe is one of the main factors for it. But a single cause is not, to my understanding, yet known.
Very interesting. Very interesting. And so, is there any way that to prevent this gene from taking on, so to speak, the shape that it does, in which it causes autism? I don't know if that makes any sense, but it does to me.
Well, Chrissy, that leads us into a very novel, very new field in medicine called gene therapy. And it's called the genomics. And we have promises. We're not there yet. There is a technology that it's called CRISP, CRISP, where you could edit the gene. We're not there yet. It's just very novel. It's new. It's beginning. What does that mean, editing the genes? Not only for autism, for other diseases like sickle cell, that could be, catastrophic. So if the gene has made a junction, if a joint or at one point of the merging of these molecules, there is a defect on it, they're gonna edit that. Like you edit a text or you edit, when the clothes, is called gene editing. And this is on the pipe. I'm very excited to see what's gonna happen when we are there. I look forward for that.
It's just amazing. Now, when they edit it, is it before the child is born, or they can edit it after they're born and after they know whether or not they have autism?
The last information that I had, one of the founders and the scientific workers on this technology, and there was a lot of ethical considerations because of the potential for good and the same time for bad. They are trying to put, as far as I understand, a lot of ethical considerations for the humane usage of these technologies. I listened to talk about how this gene editing could alter the way the mosquitoes bite and transmit malaria, for example. So they could eradicate malaria from the face of the earth in one side of the coin, but the scientific community was looking at the other side and saying, what will be the implications of that? It's not as simple as we see it, because in nature, everything is joined together, and we are an ecosystem of a larger system called Earth, and humanity is one biological organism. The ethical considerations are not there yet, so I don't know if it's before or after, but I know the technology is evolving.
Interesting. It's extremely interesting. It's amazing, absolutely amazing what technology can do, and the advances, the human advances that can be made. Like, incredible. Anybody that says that it can't be done, no, a lot of things, anything can be done, right? So
Yeah.
that's the part. Now let's go back to vaccines. So especially the part where, as I had heard, I think it was in the state of Nevada, governor, I think, and I may be wrong here, but in one of the states in the United States, the governor was was sanctioning for that all children, whoever in the state of Nevada, if they were going to enter school, had to, or not even enter school, but all children had to be vaccinated. And then, people were in an uproar. We have our freedom. We shouldn't have to do it if we don't want to. What are the implications of children, for example, that go to school and aren't vaccinated? Are those children that are vaccinated really in any danger if they already have their vaccines? And then they're allowing other children to go into school at that point in time? Would those children really be putting other kids at risk, or really just putting themselves at risk?
Yeah, a child that has not been vaccinated is at risk of childhood preventable diseases, himself or herself, because the fact that they have never had the vaccine, or they didn't get the disease. As an example, let's say polio or chickenpox is very common. So you get the disease, you get the immunity, you protect it. You don't need the vaccine. If you didn't get the disease, then you get the vaccine, you protect it. That's on a very large scale. But if a child is not vaccinated, a child is at risk of getting the disease, and also be a transmission of the disease for other kids that don't have the conditions of a normal child. Let me say, there are kids that have immunodeficient immune system, immunodeficiencies. They don't have, a strong immune system for different causes. There are kids that are cancer survivors that are no candidate for these vaccines. Like, for example, in my office, if a child is exposed to this other kid that is unvaccinated, it could be life-threatening for them. And the other concept I want to bring to the table, Christy, is that we live in a society when there are a number of decisions that are going to affect not only yourself personally, but also the community at large. And that's the issue when the child is going to school. Like in the state of New York, where I practice, some of the vaccines are mandatory. When the child is 5, it has to have a number of vaccines that are mandated to allow the child to enter the school system.
And so therefore, if they don't have those vaccines in the state of New York, they cannot enter school.
Yes, many school districts and the Department of Education, they are going to require that the child is immunized against some of the vaccines in the immunization schedule. Some of them are optional, but some of them are really mandatory for school entering.
Mm-hmm. And it's really interesting because I think you have two different sides. I think you have those that just, for example, here, maybe in the Dominican Republic, maybe women just aren't educated in what vaccines children need to get at certain ages, and the parents might not know. And then again, in the United States, you have the other side of it, in which you have those that want the ability to choose whether or not their child has vaccines or not. And so I think that it's really important to understand both sides, but really for people to understand that education wise, vaccines really are a friend and not a foe, so to speak. They're not an enemy. You're trying to help the kids have a strong immune system. Now, in speaking of immune system, oh, go ahead.
I just wanted
Sorry.
to mirror here a conversation that I have with parents that have these fears that should I give it, I want to wait, I don't give it, all kind of situations. First, I let the parents know that vaccines are not acute medications. They're not acute medicine. Let's say if you have your oxygen is low, you need oxygen because we cannot survive long without an oxygen. It's not that kind of intervention. It's prevention.
Mm-hmm.
It's preventable. It's a prevention. So we have some time to complete processes to talk about it, to get informed, to have the father or the mother feel comfortable. But one thing that I always suggest to the parents, especially here in my practice in the Bronx, in the United States, is that you need to look at the diseases that vaccines prevent. Because what happens is that nowadays in society, many doctors, imagine the public, had never seen a case of tetanus, a child dying from measles, meningitis. I tell the parents, go in and check a polio. Look what happens to a child. And then you take both sides of the coin and you make the decision. I'm always here as a pediatrician to support you and to give the vaccine when the process is complete. But I think with that kind of discussion, that kind of openness, we are in a good area.
Yes, and I think with anything, if you're trying to convince someone to do something for the better, educating them as to why it is better is the most important part. Because if they don't understand nor have seen the seriousness of the diseases, they're not going to understand it until you show it to them. And that goes with anything. Um, so yeah.
Absolutely.
Now to kind of wrap up everything in right now with the way that things are going in life, the immune system and a child's immune system, everybody's immune system is really important. But how can parents ensure that their children have healthy or how can they boost their children's immune system and in these times of germs, and I mean, there's always been germs, and I mean kids are germ city.
Certainly, they do get exposed to these germs in early childhood, and that's how they build a strong immune system. They get all these experiences and flavor, and they develop their own army. Let's just say it that way. But if we talk about how to keep our kids healthy and with strong systems, including the immune system, I think nutrition is key. I really a pediatrician that stands for teaching our kids what it means to nourish your body. I think it's our duty as a society that every child knows how to feed his or her body to be healthy. When I talk to my patients and my parents, I said, I don't want you to say that, oh, Dr. Olivero don't want me to drink, let's say, this beverage with this high, sugar like sodas.
Right.
I like you to know the load that that puts into your kidneys in the filtration system. I want you to know that this is going to give you a lot of sugar, 10 times more than what you were created for. I want you to master yourself, your body. And I think it's the least thing and we could do for our kids. One thing that I recommend the parents is to start with basics. What is a good nutrition? Well, a good nutrition is one that honors what Mother Earth gives us, not what companies have put on the shelves. Because we don't do it better than God. We don't make it better. And
Mm-hmm.
if we want to keep this is created. We are made of the same elements as the earth, as the universe, as the star. The atoms and the particles are the same. So if we want to keep healthy, the best thing is to start good from the beginning. Healthy nutrition. What does that mean? No processed food, no cans, no bagged food, no food that a company made and put preservatives, because the goal of a company is profit. It's not your kid's health. It's very
Right.
simple. I think
Mm-hmm.
if we apply common sense, everything will fall into place beautifully.
Absolutely. And I think too, like here in the Dominican Republic, I think it's easier to eat natural because fruits and vegetables and things like that are are not necessarily high cost. I can buy an avocado for $1, probably two, or a pineapple, or um,
Mhm.
carrots and tomatoes and fresh fruits and vegetables for a relatively low cost. However, I think that the issue in the United States is that the healthier that you want to eat, the more expensive the product is. And I think that that's where the market and especially there in the US, that needs to change, because you want to be healthy, you want to eat natural, you want to get rid of pesticides, you want to do organic or whatever it may be. However, those come with a much higher price tag. And for people that are on a fixed income, low income, a box of mac and cheese is 50 cents. And so therefore, people are going towards the less expensive items. However,
Mhm.
yeah, and so what do you say to people who are struggling in that aspect? They want to be healthy for their children, but they can't afford to be healthy for their children.
Now, and you have mentioned something very close to the reality that we experience here, which is the food insecurity, uh, the the availability of healthy food in inequalities that are here into our city. We're still dealing with these, uh, and the choices that a family member has to make, buying this food or paying this bill or paying the rent or buying healthier food is very real for families. If we stand on that, then we're going to say where to start. The conversation that I have with my patients, I want to empower them in the knowledge they need to manage to have an equivalent nutritious food with the same budget versus a caloric rich and nutrition poor diet, our American diet. Let me just put it that
Mm-hmm.
way. My goal is to have that conversation, that knowledge, that empowerment that is going to allow this person that is in charge of feeding this family to make clever choices in a
Mm-hmm.
budget. There is still a chance for us to make other choices, to learn how to combine our food, to learn to substitute and not going for the fast food context that has been planted on us. It's time for us to say no to that context and create a new one. And I think it doesn't matter where you are in the financial chain. If we're making the decision, and mostly women make, if we make the decision, we could change all that. And I empower and encourage every mother to do that for their kids.
Mm-hmm. Absolutely. Because really, I mean, if a parent has the money to purchase fast food, you have the money, then generally probably make 3 meals out of what you spend on fast food, you know.
Let me give you an example, Christy. It's very crucial that we have this conversation. Most of us in society, we know that eating healthy is good. The problem that I see is many people don't know how. The how is the gap. The how is how conversation that we need to have.
Right.
Because it takes time, it takes education, it takes knowledge, it takes creativity. I tell my patients, most kids when they're young, they like French fries. It's a favorite of many kids. And then what is the alternative? So if we know that we're not going to eat processed, high fructose and fried food, it's not the same going and buy a French fry or a bag of potato chips, for example, than taking a potato from the earth, slice it thin slices, putting some salt, some spices, or some olive oil for the kids, and put it in the oven. And you get the same meal, the same crispiness. It doesn't take more time. It takes more knowledge and skills.
Right.
Because the bag of French fries has a lot of preservatives that is going to weaken the immune system of a child versus the one that's made from Mother Earth. This is the conversation. This is the kind of knowledge that we have to master to be able to change this context.
Absolutely. And this could be a very good future episode for us.
Oh, yeah.
Because
the how is crucial.
The how is crucial. And I think, though, but I do think American society is, you know, they want quick and convenient. So what it takes for me to pop open a frozen bag of French fries, put it on a cookie sheet and stick it into the oven, or take 5 minutes more to wash the potato, slice it thin, and stick it on the cookie sheet. Like literally it's 5 minutes more. It's really not, it's not anything, it's not anything major, you know? However, I think that, you know, sometimes it's important for parents to understand that like convenience and the actual time it takes to do something isn't really that different. 5 minutes, 10 minutes.
Convenience, you know, we've been moving into an automatic program. The COVID-19 has disrupted many patterns. And one of them is the pattern of what I call the robot, the automatic. We just moving and moving and moving. But if we stop and we reprogram ourselves and we reset our buttons and we give our health the attention and priority it takes, I believe we're going to be really empowered and we're going to be really able to take control of our health. This is something that is desperately needed in America and in the world.
Absolutely. Absolutely. I do definitely agree with that. So, but yes, so that's going to be a lovely future episode that we have.
Most definitely. How to take control of your own health. We should all be talking about that. Not from medications necessarily, but from things that we all have to do and know.
And children ultimately learn their eating habits from their parents, you know, and so as they grow up, if you're not exposed to proper healthy eating, then the kids are not going to be aren't going to know what proper healthy eating is. And that's really, really important. But it's also important that, again, it may not be the parents' fault. They may not be educated in how to do what proper healthy eating is, nor maybe they don't know how simple it is to create a healthy meal.
Yes, it's a, you know, in my case, I'm gonna relate to that because I went to medical school and the information that I received about nutrition was minimal.
Mm-hmm.
It was minuscule compared to other subjects. Not that nutrition wasn't important, the others are not important. That's the way it was. So that subject that is crucial to determine the health of a person, to prevention of heart attacks, strokes, Alzheimer's, cancer, it was minimal. And I realized at a point in my career that I had a deficiency of knowledge in that area. So I had to retrain myself and dig down again and what are the things that I needed to know to convey to my patients so they could take control of diabetes, that you don't need to be a diabetic just because there is a high incidence of diabetes in your family, or you don't need to be suffering from hypertension and be on medication all your life or high cholesterol, to name a few. What things we should all know that is going to empower us to say, okay, you know what, my family had this, but I decide that I'm going to take this route because this is possible. And it's all based on things that we have to do into our daily routines. And I think this is a very important conversation that I would love to have with you.
Absolutely. No, absolutely. I agree, because there's so many different facets to it that people really need to know, and children need to know too, and that we need to educate them on. And that's what we need to do.
Absolutely. And train them with love, with care, fun. I believe that the ultimate measure of success is how successfully and how healthy you live your life.
Mm-hmm.
As I said, if you gain all the success from the context, you get the major degree, you get a high paying job, you are successful, but you don't know how to nourish your body, and you are suffering from one of these chronic conditions, or you get a heart attack at 40 years of age because there were things in your life that you didn't master, I think the measure of success is faulty at that level. And without saying it's fault, there is a gap that we need to close there. There is information that our kids needs to know. The success is be able to be happy, be healthy, and the biggest asset that we all have is our own health.
Absolutely. What is it? Yeah, it's one of those things. I mean, there's multiple facets to success. You could be successful in many areas and failing in other areas. And you know what the picture of success is a balance amongst all those areas, really. You can be successful in your career, but you could be, you could be treating your body like horrible, or you can be a successful parent, but yet you're not doing well in other areas. So it's trying to find a balance amongst all those areas, which is truly the picture of success.
Absolutely. And I say that categorically because I have witnessed that when life is going well and you have your health, you take it for granted, and you have many aims, many goals, focus, you are navigating the waters of life. But when you lose your health, you have only one focus: to recover your health.
Right.
And
Because
that to
without
me,
your health,
yes.
and that's very true. Very true. You have no health, you have nothing, really. And that is so true. I need to take that advice myself, not because of my diet, but because of my, constant work schedule. But anyways, that's for another time too. But as you know, but although there has to be a balance, So, and we have someone here that says, hello, hi, Dr. Anna, I enjoy listening to you. And so I think a lot of people enjoy listening to you. So.
Thank you very much.
Yes, I want to thank you again. Me too. This is great. I love talking to you, and I love sharing all of this wonderful information with everybody. And even if there aren't so many people watching at the moment, afterwards, there's lots of people that watch. So I think it's fantastic, and I appreciate you taking your time out to share this. And I think I can speak for everybody out there that watches you and watches us doing this. I think that they're really appreciative in that you take this time to share with everybody your knowledge and expertise in these really important areas for parents and for children.
Thank you very much. I want to thank each one of you for the generosity of your time to listen, to be in this conversation. And I'd like to remind your audience that we are available through telemedicine. It's a new way of doctors to do medicine, to reach out to patients. We could use the technology. It could be the audio part of it. It could be a video kind of visit, and we could really provide services now in the times of COVID. I am providing the services as without charge, without financial charge, as a way of keeping the doors open for the parents that are in need of pediatric services. I'm available through my phone lines and to my staff and my answering service. My office is Ola Pediatrics, and my number is 718-548-4040. 718-548-4040.
Yes, and usually after this, I always go through and review the video, and I stick it at the bottom of our interview, so that anybody that wants to will be able to contact you, and that's wonderful. And I thank you so much for that. That's really a great service for so many people. So thank you, and it's in English or in Spanish, so that's even a better benefit. So for all of those in need. So thank you so much again.
Thank you. Good night.
And good night, everybody. Thank you for tuning in, and we'll hopefully see you again soon. Good night.
Good night.